Thank you, Maria. Thank you for the presentation, and thanks to your staff for all of the hard work, specifically, like you mentioned, Claude, Rebecca, and Jesse, and all of their teams for putting this plan together. This committee has provided a lot of feedback on the recommendations, and I feel that this plan is reflecting mostly our collective priorities. As we talk about youth and mental health services, we need to keep in mind access to mental health services. And Maria, you brought up transportation, children finding their way to these mental health providers and who they feel comfortable talking to. I think one of the outcomes from the youth group was to provide access to texting so that it's more private. So I appreciate that you bringing that into it as well. And I'll just make a quick note. I think our school counselors in most public schools, they're not trained normally to be social workers. They do a lot of testing and you know, a lot, unfortunately, in our school system, that a lot of the curriculum has to be driven towards standardized testing. So I think our counselors are having to focus on that. And so I don't know that we actually have right now in the school system adequate mental health. So I really do appreciate the focus on our youth. My personal mantra, not only in my role here as counsel, but as an attorney, as just a person, is I try to find the most vulnerable populations and advocate for them. I think that's what we're doing here today. We're talking about seniors, we're talking about veterans who are houseless, and we're talking about foster children, among other very vulnerable populations, so I appreciate that. I do have a question about Project Worth and Stand Up SA. Do you know how many youth are currently being served by those programs? Okay.
Claude Jacob to address that question.
Good morning, and thank you for the opportunity to provide updates about the programming, the exciting programming at Metro Health. So Project Worth, just a reminder, this program has been in place for a couple decades, and it's an opportunity for us to have our teen ambassadors who are resources on the ground to continue to connect and be the best connectors to their peers. So in broad strokes, this is a program that connects teens in grades 7th through 12th grade. The program works closely with staff on initiatives that bring awareness to various teen health-related issues while gaining important skills that they use in going into the workforce or into college. So over the course of each year, there are over 1,600 no-cost behavioral health counseling sessions that are provided through this outlet. And we have youth who can access as many counseling sessions as they request. The services are provided in school or on campus and at the teen clinic. So at the end of the day, there's an opportunity to build the capacity and the reach of the program. We've heard loud and clear through the Youth Commission. We've heard loud and clear from our staff that there's an opportunity to add, again, another dimension, another component, and expand our reach. So bottom line, this is an opportunity to build a program, and we're excited about the opportunity through this funding.
About how many youth would you say that these two programs serve right now?
Well, Project Worth is focused on the teens. The other program that we're talking about is Stand Up SA, and that's been focused on adults. So this is an opportunity to at least develop a junior component to Stand Up SA. But I would say that in terms of the volume of the Project Worth, I'm just looking at the number of counseling sessions, but I'll at least circle back and let you know in terms of the volume and the reach.
And are they're citywide programs, right? So it would touch every.
These are citywide programs. We have dedicated staff who connect with different partners, especially anchored to the school-based programs and area nonprofits. But again, this is a component that we're building anchored to our mental health initiatives here in the city.
Okay. Thank you, Claude.
You're very welcome.
I'm going to shift over to our seniors. We know a lot of us that we have city senior centers, of course, but we also have a lot of churches or other organizations that will have nutrition centers in their neighborhoods. They're really effective. Claude mentioned connectors. A lot of times the seniors will listen to their pastors and go and seek services that way. So I'm curious if senior centers that are not city senior centers, if they might receive some funding under this plan.
At this point, Councilman, we are not recommending expansion of hours other than for the comprehensive senior centers. However, we do have in the plan for older adults navigation programs, and we are asking delegate agencies to help us promote the programs that we have for those individuals that are not attending our senior centers that perhaps, to your point, may be going to their churches or other facilities to encourage them to come to the comprehensive senior centers and provide them services, and not only those connections to the comprehensive senior center, but also to mental health services that they may need. So that is part of the recommendation.
Okay, thank you.